So what we have here is a simple demonstration rig of a conventional ambulance that's used throughout Ireland. And if we have a look inside there, you can see we have a very high specification training mannequin who can mimic a patient exactly. So we operate in sort of a standard 5-letter system to have an airway, do we have breathing, circulation, how they respond neurologically, and if we can find out what's wrong with them. And this mannequin is able to mimic absolutely everything we want. So it can bleed, it can sweat, it can urinate, has blood pressure, all the breath sounds, all the airways. So it really does mimic a clinical patient as best we can in a training session. And you also find that in the cab we have a mirrored one-way bulkhead. So what happens is a teacher or an examiner is no longer with the student. The student has to learn for themselves as to how to get on, and we sit in the control room then and we can control the functions of this mannequin. It really does maximize the learning effect that the patient goes through, or the learning styles the patient has to work with. It's confined space, as in a real ambulance. It's confined lighting conditions, as in a real ambulance. And essentially, it just brings a whole new reality level to our patient care training. Okay, so the way we do is we work in groups of 8, and essentially then we talk through it. We go through the individual skills they'll be learning, and then quite simply, one at a time, they would go through the system and operate it as they would as a single person in a real ambulance. What you can't see here is some of the fancy electronics then projects the image of the training paramedic to their class. Okay. We actually then use a peer review technique, so rather than an instructor, waving the finger, it's actually a debrief from their class peers, which makes it work in that manner.
And is there opportunity, Mark, for other groups like voluntary services, other services to rent this, to use it for their training sessions?
Yeah, absolutely. And I think that's something that universities perhaps are very guilty of. We have such high specification equipment, which is very expensive, but do we maximize its use? Yeah. And I think deliberately then we've mounted this on a trailer, so it is mobile, and with relevant permissions and agreements, anybody who wishes can borrow this vehicle, can make use of it, and again have access to the high-end, high-fidelity equipment that they wouldn't normally get in a normal training environment.